question I have for you
Okay.
is not even in there, but I'm going to ask you.
Oh, okay.
So is um, medicine a career choice or a career option that you would, um, what's the word, advise your children to take?
Um, for me personally, um, based on how healthcare is going, it's not like what I'm used to, like what I'm let me say, it's not like what I, it's different from when like my aunts and them when they would talk about being in medicine and things like that. I
Mm,
thought I would get to experience a lot of those experiences, and
mm,
it's a lot different. Things are very fast paced. They want you to more so rote learning. Um,
you
and
mean rote learning? What is that?
so a lot of things, like, everything is training, comes down to training.
Yeah,
But they have a lot of different protocols for different, let's say, different diseases,
right.
on how to treat that.
Okay.
That is something they just want you to know, which there are things that you just have to know. However, for me, and hearing how, a lot of like the older physicians used to talk, a lot of things was you had to think about it.
Mm,
So a lot of my colleagues, even though, let's say you learn something new and you want to share, yes, some of them may listen, but some of them is like, we'll deal with that later. We need to just get through this with this, and no one
mm.
really wants
They
to
want to kind of
learn. They just want to get through their day and go home.
uh,
But I feel like medicine should be one of those things that it's a lifelong, learning process, and it's one of the highest educations I believe that one can receive, because you're dealing with, so many, like, you're dealing with people's lives, and I just feel like it requires all, one's full, like, let's say, one's 100% focus from whoever's practicing. I just don't see it going that way, these days. But it's still a great profession nonetheless, and you still have ability to impact other people's lives. So if I would advise my children to do it, I would tell my children to do whatever makes them happy at the end of the day, because this is something you have to live with for the rest of your life. So you have to just be well educated and understand what you want to do to make an impact on other people's lives. I mean, there's so many different ways that you can, there's other things that one can do, but medicine is one of those specialties where not specialty, it's one of those areas of learning where it's lifelong, and you have to be fully committed to it. If you're not going to be fully committed, then I would say, do something else that you might enjoy.
right.